Colin.
Well, the situation, Alan, can be considered critical. Ontario hospitals have been struggling under the weight of all of the pediatric admissions that have been happening over the last few weeks. Already, patients are being shuttled from one hospital to another as they just look for room and available beds for those patients. But now the province is asking the question, what happens if Ontario hospitals run out of room? And they are looking south of the border to potentially shuttle patients there just so that they can have care. The past few months have posed a significant challenge for Ontario hospitals. Too few beds to serve too many young patients, forcing emergency departments to turn to other hospitals for support.
Having that cooperation, that ability to move patients when necessary is a really important way for us to balance the load in Ontario.
The latest data on patient transfers from Ornge shows the scope of the problem. Between August and November of this year, there was a dramatic rise in pediatric patients being transferred either by land or air ambulance.
Ornge are seeing a significant number of increased pediatric transports, specifically with respiratory illness.
In November, nearly 140 pediatric patients with respiratory illnesses needed to be moved to an open hospital bed by Ornge alone. That's the highest number they've recorded since 2018.
This is the first time we've seen such significant volume with pediatrics, and yet again, it's not just Ornge, it's the pediatric teams as well as land EMS that are moving these patients.
In some cases, patients are moved within cities. Other times, they're moved hundreds of kilometers away, anywhere an appropriate bed is available.
It's hard on families. It's a long distance to move. For instance, we'll see patients that would normally flow to Hamilton or Toronto now being moved to Kingston or other hospitals as an example.
But now Ornge is preparing for the worst case scenario, a complete shortage of beds. Currently, there are 119 pediatric patients and just 11 pediatric beds available in the entire province. So what happens if Ontario runs out? Part of the plan, Ornge says, is to turn to hospitals in the United States.
The natural instinct would be that hospitals that are on our border, such as in the upper state of New York, as well as in eastern Michigan, as well, would be the natural sort of fit as where we'd look.
For now, the province has yet to resort to those drastic measures as hospitals share the load. And the health minister is stressing parents shouldn't second guess.
If you believe that you need to take your child to an emergency, absolutely do it.
But the province is bracing for the worst, expected to come over the next 4 to 6 weeks. A lot of these transfers are not local. In some cases, patients are being moved from northern Ontario to southern Ontario. And sometimes, while Ornge says they try to have parents go with their children, it's not always a guarantee, especially if they're traveling by air ambulance. If you want to read more about this story, we have more online at globalnews.ca. I'm Colin DeMello. Alan, back to you.